Hello and welcome to Bernama. You are watching The Nation with me, Elane, Abdullah. Today I'm speaking to two very special guests. We're talking about gamma knife surgery. But before I go into that, at UKM Specialist Centre or Ukmsc, more than 50 patients have undergone treatments since November last year. Now, although it's relatively new in Malaysia, its popularity around the world is telling. So since its soft launch in November 2019, the Ukmsc Gamma Knife Centre has treated patients with various brain problems. I'm not going to go into the list. We'll let the gentleman tell us all about it. Now, we have Ukmsc housing the state-of-the-art stereotactic tactic radiosurgery or SRS machines. The Lexel Gamma Knife icon, Gamma Knife treatment in Ukmsc is carried out within its own Gamma Knife Centre. It is one of the few services in the world that has a building dedicated to it. Now, the centre offers a full complement of specialists such as neurosurgeons, oncologists, radiotherapists and physicists. Today we have in the studio two of them. Hello and welcome, gentlemen. On my left is, of course, Professor Dr. Rameh Kumar, consultant neurosurgeon at Ukmsc Gamma Knife Centre. And of course, Professor Dr. Fuad Ismal, consultant oncologist at Ukmsc Gamma Knife Centre. Welcome, gentlemen. We're talking about brain surgery. Now, when we talk about brain surgery, it always conjures up, really scary images, cutting up the head, it's going to be a life or death. You're not sure whether you're going to make it through with this kind. But we hear that this gamma knife, it's non-invasive. It sounds really interesting. Perhaps we'll start with you, Prof. What is gamma knife treatment and why is it called knife? There is no insertion.
Good afternoon, Elane. Thank you very much for having us. Yeah, so gamma knife is a very interesting idea. As you mentioned, it's non-invasive. So gamma knife is actually the use of radiation to treat brain disorders.
Okay.
Yeah. Actually, despite its name suggesting, it's neither a knife nor does it involve surgery.
Okay.
But the outcome is the same as surgery.
Okay.
And in fact, the blades of the knife are actually focal radiation beams, right, that are very precise and very accurate. When I say very accurate, we're talking about sub-millimeter accuracy.
Right.
So hence, gamma knife is the use of gamma rays with these sub-millimeter accuracies, an outcome that's the same to surgery.
Right. Now, let's quickly talk about the names of the diseases that I didn't mention earlier. What are the diseases and disorders that can be treated by gamma knife? Because you say it's not just specific for tumor. A lot of brain disorders can be treated with this.
Yeah. So broadly speaking, Elane, we can divide it into blood vessel disorders.
Okay.
Yeah. And then you have tumors, and then we have functional disorders. Functional disorders are like overactivity of nerve cells.
Okay.
Okay. So I'll start with the first group, which are what we call blood vessel disorders or vascular problems of the brain.
Right.
So one particular condition we call AVM, which stands for arteriovenous malformation.
Okay.
So basically in an AVM, you're born with this problem where the arteries and the veins communicate abnormally.
Okay.
Normally you have capillaries in between that buffer the blood, so you have blood coming in from a high pressure system and then draining into a low pressure system.
Right.
So when you don't have capillaries buffering the pressure, it's likely to cause bleeding.
Right.
Okay, it can cause bleeding, can cause seizures, can cause focal weakness.
Right.
So one of the ways of treating AVMs is to give them gamma knife.
Right.
Another blood vessel problems that you can get are known as cavernomas.
Right.
Okay, cavernomas again are abnormal leash of blood vessels that you're born with. So a lot of these abnormal blood vessels are what we call congenital problems that you're born with.
Right.
So that's sort of the first group that we can treat. The second group that we can treat are tumors.
Right.
So tumors, you have the two extremes. You have the slow-going or what we call benign tumors. And then we have the what we call high-grade tumors, which are very fast-growing.
Right.
I'll start with the high-grade tumors first. So high-grade tumors, you're talking about secondary tumors. So you could have lung cancer, breast cancer, and it could have spread to your brain. Yeah? So it's very, very good for treating secondary tumors.
Right.
The other aggressive tumors that we're treating are what we call gliomas, which are inherent tumors that develop in the brain. When the brain cells grow out of control,
Right.
we can consider gamma knife.
Right.
And then if we go to the other extreme, the benign tumors, like meningiomas.
Right.
So again, this sounds alien, but meningioma actually arises from the lining of the brain. Not within the brain, but the lining or the skin of the brain.
Right.
So it's an effective treatment there. And then we have another tumor known as acoustic neuroma. Acoustic neuroma is a tumor of the nerve of balance, which occurs behind the ear.
Okay.
And the third type of benign tumors that are very good, effective, are what are called pituitary tumors, pituitary adenomas. So your pituitary gland sits at the base in the center of the brain. It secretes hormones that regulate the function of the rest of the bodies.
Right.
So that's sort of the tumor groups. And then finally, we have the functional groups, which are, when I mentioned earlier on, overactivity of the nerves.
Right.
So some examples that we can treat is facial pain, condition known as trigeminal neuralgia, very painful condition.
Right.
Yeah?
I have a friend that has that, so I can imagine, you know, it's going to be a life-saving or a much better option versus, you know, not knowing how to treat this if gamma knife is an option for them to be able to treat this.
Yeah, it's a very good, effective alternative. In fact, patients with trigeminal neuralgia suffer a lot. They get a lot of tooth extractions before they realize it's trigeminal neuralgia.
Yes.
They lose a lot of weight as well because eating is a big difficulty. Every time they move their mouth, gush of wind causes pain.
Yes.
So then the other functional group is epilepsy.
Yeah.
And then we have the whole sort of movement disorder, things like Parkinson's. And then now the big area that we're going to is neuropsychiatric conditions, things like obsessive compulsive disorders.
Can be treated with gamma as well?
Yes, those are that are refractory to medication.
Right.
So you can consider.
Now, I think Dato has been sitting here watching us have this conversation. Now, Dato Fuad, how common is this procedure in Malaysia and also worldwide? It's apparently new here, but how is it new worldwide?
No, it's not new. As Ramesh mentioned, that the technology has been around for quite a number of years, at least 30 years, and it's getting more popular. There are many more centers being built all over the world. I think at least 300, 350 centers around the world. And if you look at the history, about 30 years ago, there's only about 6,000 or 7,000 treatment a year, and now it's about 1.2 million in 2018.
Wow. Why is it only gaining traction now?
Because of the technology.
Right.
Gamma knife is a very precise treatment. Earlier the computers were not so powerful, so you spend a long time trying to plan out your treatment. You have to the accuracy is there, but you need to calculate how much rays, where the rays should go through, and so on. But with very powerful computers now, then the planning becomes much faster, much easier, and therefore it has become more popular. If 20 years ago, maybe you can treat one patient a day.
Right. Okay.
Now you can treat maybe 4, 5, 6 patients a day.
I see. Because I would think that with a non-invasive option, the risk would be lower, and it would be a much better option, or more people would want to explore this option versus I don't know, opening up your head for surgery.
Definitely. But the thing is, you are treating something on the inside, so you need very good imaging. Right. You need very good planning. You need very good dose calculations. So the CT scans, technology has moved on. So CT scans are much better. MRIs can show us the tumor much more accurately. So that's why the gamma knife and stereotactic treatment has really ballooned up and exploded around the world.
Now, can both of you explain how the process? How does it start? Perhaps Dato, you can explain the process of how a patient is identified for a gamma knife treatment.
Okay, maybe I'll let Ramesh explain the first bit, which is the frame setup.
Okay. Prof.
Okay. Just before that, when a case gets referred to us, or Dr. Fuad and I find a patient deemed suitable for gamma knife, we have a multidisciplinary team meeting. Okay. So in this meeting will comprise oncologists, people like Dr. Fuad, neurosurgeons, myself and my colleagues in UKM. We have physicists, and we have neuroradiologists sitting together, and we discuss individual cases. So when we deem that the case is suitable for gamma knife, we then invite the patient for treatment. So basic setup, patient comes in the morning and has two forms of treatment, either a frame-based treatment or a mask-based treatment. Right. So I will start with the frame-based treatment.
Yeah, we will have a video to show of a frame-based treatment patient who will explain that to us in detail about the whole process. But once you've identified, how long is the entire process? What's the whole, is it like, it takes 1 week, it takes 1 day, it takes 1 hour?
It's a day treatment. It's a day treatment.
Wow, how is surgery a day treatment?
It's amazing, right?
Yes. So how far we have come.
So Ramesh, the neurosurgeon generally will put on the frame, and basically the frame is a very rigid well, it's metal, so it has to be very rigid. The machine accuracy is millimeter.
Right.
So the worst bit of accuracy is the patient. You cannot have the patient moving at all.
Right.
So we literally screw your head to the frame.
Yes.
Literally, yes.
Yeah.
Just adding on to that, why we use the frame, because on the frame it's got X, Y, and Z coordinates that we will input into the plan that tells the machine exactly where we want to treat.
I see. So that's the frame. That's for you to map in order for you to be able to ensure that you are hitting the cells that you want to hit and not hitting the cells that you don't want to hit.
That's the first bit.
Right.
So first of all, you have to make sure the patient doesn't move. So that's the frame.
Okay.
Then the second is, where is the tumor?
Okay.
It's inside. So with the frame on, the patient undergoes a CT scan and an MRI.
Ah, I see.
Right. So the MRI will show you where the tumor is more accurately than the CT scan. But the CT scan, you need it so that you can do your planning. The beams and the amount of beams that you need, the dose that you need, is based on the density of the tissues in your brain.
I see.
So we use the MRI and we use the CT scan. Sometimes we need to use an angiogram for the blood disorder, the venous disorders. Yeah?
Right.
So now we have the two things. The patient is not going to move. We know where the tumor is.
Now
then we'll
shoot
map
it.
out.
You need to map first.
The tumors, unfortunately, the tumor doesn't come in nice round balls and so on. Not like a gully or something like that.
Right.
So the tumors have all odd shapes. The two or three of us will sit down together. We start to draw out the tumor millimeter by millimeter, literally.
Wow, that sounds tedious.
Yeah, it is very tedious, and it's in 3D. So we do this and we look. We have to make sure that we get all the tumor in. And avoid as much of the brain as possible.
Right.
Then between the two of us, we'll start the planning process, draw the tumor, we put in what you call the shots. The easiest is you imagine a magnifying glass, you focus little bits of rays here, then you go to the next spot, you go to the next spot. But we cannot be doing that on the patient and then go plan again. So we plan everything in total and then we move on to get the patient to the couch for treatment.
Right. Kids don't do this at home. Go to a specialist who knows how to map it and how to target and how to map in order for us to be able to gain the best results and outcome. Now, of course, that sounds like a whole lot of work, but there's you did say that you could, if you wanted to, once the whole procedure is done, be out of there and be ready for action the next day. Is that true?
Is that for the patient? Yeah?
Yes.
Yeah. So as Dr. Fuad mentioned, a lot of these are day cases. So patient come in the morning, and then the whole planning process can take about half a morning easily, depending on the complexity, the treatment. So by about midday, the treatment is over.
Right.
So there's an observation period for about an hour before we let the patients go home. We tell the patient rest for a day. And then literally after that, the patient can go back to work.
Right, that sounds really amazing. Now let's hear from the patient's mouth herself. We have, of course, a patient that has recently undergone gamma knife treatment at Ukmsc, and we'll roll this video so that you can hear it from the horse's mouth itself.
Good afternoon, everyone. My name is Debbie Yap. I'm in my 60s and I'm a kindergarten teacher. I had my gamma knife procedure done in December 2019. My first consultation coming here to see Professor Dr. Rameh Kumar actually was a very pleasant experience. He went in details of the procedure and the potential risks involved to me and my family. So that was very assuring. And the best part was, when the consultation ended, he got up from his chair, walked towards me, patted my back and said, "You don't have to worry, leave everything to me." So that was very comforting and very assuring. And it was a relief because I couldn't really communicate well because of the tumor in my brain. I had my craniotomy done in 2013 and 2017. But I had to come back here for the MRI each time to check on the growth of the tumor. And on the second time in 2017, I think 2017, he noticed that there's still some residue left in the brain, the tumor itself. So with that, and Professor Rameh was working on setting up a gamma knife center here. And he said that he can have the tumor removed using the gamma knife treatment. So which I agreed lah. So I think that machine looks more like an MRI machine to me, because they used to have MRI all the time, you know. So when you go in there, only thing is freezing cold, and it's freezing cold in a way, you know. And everything is done, they prep me beforehand, like MRI done, the mask all prepared, all the precision all done before they start the procedure. So I just have to be there, stay still, be calm, concentrate, and allow the treatment to go on for about less than 20 minutes, I think. I didn't actually have the frame on for my treatment. I actually had the thermoplastic mask on me instead. It was a bit discomfort because the hot mask, when it's applied on your face, they have to stretch over your face and your head. At that very moment, the heat is actually unbearable because they have to do it then to get the structure of your face. So they pull hard and they have to button onto the machine itself so they get the precise position of the mask before they can actually proceed with the next step of the gamma knife treatment. I could have, but because it was done during the December holiday, school holiday, so I took the better choice of resting at home. But actually it's back to normal again the next day, no hassle, really. I felt relief knowing that the tumor is gone, even though I haven't had the MRI done yet. But I think physically, I don't have symptoms of like absent-minded or kind of word finding itself, which I find it very difficult because before the surgery, I could have gone to the bank and I would say, get a draft. But I couldn't even name that word. I keep saying, you know, the paper where you write the amount, the money, and the girl say, what are you trying to say? And it was so frustrating, you know. So each time when I do that, I feel like crying. I said, what's the word that I come back and say, I didn't do it right. I don't know what's the term to use, you know. So even after the 2013 and 2017 craniotomy, the hazard coming back is to do the MRI. But eventually after the gamma knife, I feel relief, you know. I said, I don't have to come back. I don't have to have the surgery again. I don't have to remove the stitches. And that's the best part, is assuring for myself. I would really recommend people who have got small tumor to go for gamma knife treatment instead of having open up surgery, you know. In my case, because it was the size of 2 golf balls, which you can't take it up through gamma knife, so you practically have to open up and just remove it and just staple it back. Oh yes, yes, I will definitely. If I do come across people who are in need of gamma knife, I really recommend it. You know, honestly speaking, it's painless, it's stress-free, and you don't have to suffer the stitches and the surgery, and it's more comfortable because it's like a daycare. You know, once it's done, you can just go home instead of like surgery. Sometimes you have to stay in for about 7 or 8 or 9 days before you can go home. And then also there's a risk involved. This one is painless, the complication is less, no infection, no bleeding, no medication, stuff like that. So it's an added benefit for people who can opt to go for this kind of treatment instead of surgery itself.
It sounds like there's no downside to this, but there must be some side effects. Perhaps, gentlemen, spill the beans. Are there any side effects?
Every treatment will have some side effects. Okay. You talk about the frame insertion, so you get a couple of small holes, 4 small holes from the screws.
Right.
Hardly
that heals, yes?
Yes, very fast. Just a couple of days, you're fine.
Okay.
And when you have the treatment itself, now part of it depends on where the tumor is.
Okay.
But if you are treating small tumors, then in general, they hardly get any problems at all. There's minimal headache. There certainly is practically no risk of bleeding, no risk of infection, and so on.
Right.
It's only when you have bigger tumors and you have malignant tumor that you may run into problems, because some of the problems are actually caused by the tumor. not by the treatment.
I see.
But as mentioned earlier, most of the patients, they can go back the next day.
Seriously? No side effects, Prof?
Very minimal. I mean, again, like Dato mentioned, it depends on the size of the lesion. Sometimes do experience some very mild headaches or dizziness, but usually settles within 24 to 48 hours.
Right. So it's all good. It sounds like gamma knife treatment is the way to go. Then we ask the next question, how expensive is this? Because I'm sure we will do comparisons, you know, versus the traditional invasive surgery. Already there are a lot of points for this because it's already non-invasive. But on top of that, how do we compare with regards to cost for those invasive traditional surgeries versus the gamma knives?
Yeah, so in the video you saw a big machine there.
Yes.
It looks like, so the machine is very costly actually.
Yeah.
So in general, around Klang Valley, to have gamma knife treatment is about 30,000. Now,
but how much is the normal surgery though?
Yeah, so that sounds exorbitant, sounds a lot. But if you were to have brain surgery in a private hospital, it can range anything from about 60,000 to 100,000, depending on the complexity of the operation, how long it takes, and then there is the cost of the ICU care.
Right.
And that's provided there is no complications as well.
Oh, any day I'll be opting for gamma. If I require brain surgery, not only do I save time, save the hassle, I also save on the cost for the surgery itself. The complications are actually so much more unpredictable and could end up so much worse if anything happens with that, if you open up for the traditional surgery. I can imagine that. Okay, now, would there be an insurance that covers this though?
Okay. By and large, it depends on the insurance policy. In Malaysia, there's a lot of variabilities in insurance policy, but by and large, it covers most malignant and benign tumors.
Okay,
Yeah.
so if you have an insurance policy that covers tumors, this surgery or this option would most likely be made available as well.
Yes.
Okay. Now that we know all the advantages for the gamma knife treatment, where do we go for the treatment?
In Malaysia, there are 3 centres.
Right.
We are the newest centre at Ukmsc.
Yep.
There are a couple of centres in Gleneagles and also in Sunway.
Right.
So the machine-wise, again, I think we are similar to Sunway. But all the 3 gamma knife machines treat in a similar fashion,
right.
and I think all of us do a good job.
Is there any wait time with regards to doing this? Which means like, you know, sometimes you say that you have an issue, then you have to wait because there's a long queue, and is there any of those complications involved?
No, not really, but usually a lot of the time we are treating for benign diseases, so we take a bit of time to look at the growth pattern of the tumor. Is it really growing quickly?
Right.
Do we need to treat now, or can we wait a little bit longer?
Right.
And then we have a discussion, we make a careful decision, because essentially it's a one-off treatment. We rarely retreat patients, so
right.
so you just make sure that the patient really requires the treatment at that point in time. Some tumors are very small and very slow growing. You don't need to do too much to them.
So what are the processes post-treatment, post the gamma knife treatment? What
Okay, so a lot of it...
just go back to your daily life.
No,
I'm
more
sure
or
there
less,
would,
more or less, yeah.
There isn't any procedures, any things that you need to do, rituals, habits. I don't know. Whenever you go through surgery, you imagine you have to go through a whole gamut of rituals.
So literally, they can go back to normal working life.
Right.
You know, carry on with sporting activities. You know. From our side, we require imaging follow-up in the future to keep an eye on tumor. But literally, patient can go back to doing all the things they used to do before gamma knife.
Right. Now, let's now talk about this last question. The studio were interested in this. What is the success rate of the gamma knife surgery? And in Ukmsc itself, how many patients have been treated?
Okay, so in Ukmsc, we've treated now close to about 50 cases.
Okay.
Yeah. So when we talk about the success of gamma knife, gamma knife was developed by a Swedish neurosurgeon by the name of Lars Leksell in the 1950s.
Yep.
It was during the era of heroic neurosurgery. When
I don't even know what that is.
Okay. So that was during the time when morbidity was very high.
Right.
We didn't have modern anesthesia,
right.
bleeding rates were high, and
right.
mortality rates were high. So Lars Leksell already dedicated his life to developing an alternative.
Yeah.
So imagine from 1950s to now, we've had a lot of data, a lot of follow-up data.
Yeah.
And some of the figures I'm going to give you come from the big centers, such as Marseille, Cleveland, Pittsburgh, Prague, London. So when we look at tumor control rate, I'm going to pick a common brain condition such as meningioma. The tumor control rate is about 95%.
Okay.
And then when we look at progression-free survival, so that's the time when you get treatment done to recurrence of symptoms again. So if you look at 5 years, you're looking at 98% being progression-free survival.
Okay.
10 years, about 88%.
Right.
I pick another condition like acoustic neuroma, which is a benign tumor of the tumor of balance.
Right.
The tumor control rate is anything between 95 to 100%. By generally, acoustic neuromas, in fact, just as a ballpark figure, 2/3 of them decrease in size with time, 1/3 stay the same, maybe about 5% may increase. So very good odds.
Right. So, in summary, as we wind down our session here, what would be your advice to viewers? Because I think a lot of people may not be familiar with it at this point of time and may not consider it. Dr., what are your thoughts on this?
Yeah, radiosurgery is quite new in Malaysia, and it's certainly a very effective treatment. And one of the advice I'll say to patients is that always consider what are your options. I mean, if you've met somebody and he's advised for surgery or whatever treatment, always ask for a second opinion. And especially if you've got a malignant tumor in the brain. So cancer is very common. So quite often the cancer has spread to the brain. And here, when we are talking about success, we want to have the patient not only living longer, but with the best quality of life. So, so radiosurgery is certainly something to be considered. Before this, you say that cost is very expensive and so on, but not in relative terms. So always talk to a second person, a second neurosurgeon or second oncologist to see what are the best options available for you if you have a brain tumor.
There's no comparison for quality of life, isn't it?
No, I don't think so. Better than getting your whole brain irradiated, because you keep your mental faculties intact in general.
Exactly. So if you're going through it and you're not going to be able to enjoy your life after that, it's just going to be difficult. What about your thoughts, Professor, in closing, compared to, of course, the other traditional surgeries that you've done in the past, and now having this option to use for your patients?
Yeah, I think it's a very good alternative. It does help us reduce the amount of risk we take compared to before, because in some big complex tumors, we can leave certain small residual tumors that we can come back and treat with gamma knife. So that's also another option. So sometimes you can combine surgery with gamma knife. There's one caveat I want to leave behind before we finish. While it sounds great, go back to work next day, minimum side effects and everything, not all lesions can be treated. Every case needs to be discussed case-by-case basis.
Right, okay. So it will have to be upon diagnostics, upon seeing the individual patient, and then we'll be able to see whether this option is available. Thank you, gentlemen, for coming into the studio to elaborate and to educate and enlighten us about the availability of gamma knife radiosurgery, brain tumor treatment without surgery. The best way to do this, essentially. Now, of course, in closing, I'll just have a quick conclusion with regards to gamma knife stereotactics radiosurgery. It is, of course, non-invasive neurosurgical treatment with high-intensity radiation, if you didn't already gather that from all our conversation. And this is in Malaysia. There are currently the 3 gamma knife machines, and the centers, of course, Ukmsc. You can head on there if you are considering this as your option. Thank you, both gentlemen, and thanks for joining me on The Nation. I'll see you again next time. Bye for now.
Thanks.
Thank you.
Kes positif COVID-19 ini telah kembali mencatatkan angka 2 digit sejak beberapa hari yang lalu.
Sejak 1 Julai 2020, Kementerian Kesihatan telah melaporkan 15 buah kluster baru.
Kalau dia terus tinggi, meningkat sampai 3 angka, kita terpaksa tutup pun. PKP akan dilaksanakan.